Dr. Graham, the back pain professor. Most of my patients that come in here, when we do the consultation, I'd say 8 out of 10 of them are taking ibuprofen for their pain. And I wanted to explain a little more about ibuprofen because there's a lot of risks that are there that I don't think a lot of people know about. So with that, let's go ahead and get started. This next slide, some people, some of these brainiacs, they're into chemistry and everything. So this is a molecular structure of ibuprofen, just in case you wanted to know. But I'm going to go ahead and move on. I'm assuming that's not important. This is what people take it for primarily, is pain, usually in the back and neck. That's what I usually see up here. And here's a laundry list of some common forms of NSAIDs. Advil, Motrin, and a few other types. And there's your naproxen, your Aleve. These are the group that most people that come from office, that's what they're taking. The way ibuprofen works is that the ibuprofen interferes with an enzyme that triggers inflammation. So you take this and it basically shuts down this inflammation enzyme. Now, ibuprofen is advertised to help with back pain, neck pains, inflammation, things like that. But as I looked at on the internet, I found all kinds of different types of side effects that go with ibuprofen, anything from abdominal pain to a coma. So these are just a few of them, but there's one in there that's real common that I want to cover now. Probably the biggest culprit from taking ibuprofen is that stomach, the stomach and the intestine, because what ibuprofen does is it reduces blood flow to the stomach and the duodenal lining, which is in the intestine. And this layer that's there that it interferes with, without that layer, stomach acid can damage this gut lining. And when that gut lining is damaged, it can lead to ulcers. See, this material should look like this. There's a hole there. There's a hole. There's a bleeding ulcer there. This was really interesting as I studied this. There's a doctor, I can't pronounce his name, it looks like Ray Shidroy, and he's a consultant gastroenterologist in London. And he says that everyone who takes NSAIDs will get small erosions of the stomach, which can actually happen after a single dose. And people, that's scary. Bleeding stomach ulcers can cause a variety of problems. This is called the Valentino Syndrome. This is after Rudolph Valentino. The syndrome that he had was death. He died in his 30s from a bleeding stomach ulcer. Other unwanted side effects are erectile dysfunction for the males and renal cell cancer for both men and women. In fact, ibuprofen is so common in the medicine cabinets that I believe people just eat them like they do Smarties. And people are thinking, this bleeding stomach stuff, or maybe they don't know about it, but no one thinks it's going to happen to them. Now, some natural alternatives to ibuprofen are as follows. White willow bark is good. That actually can help get rid of inflammation. Now, the good thing is you don't have to find a tree and pull the bark off and eat it. You can just they have them in pill form from Swanson's. It's white willow bark. Another thing you can do to prevent or to stop inflammation is omega-3s, and those are in fish oils. But the good news is you don't have to go out and catch a salmon or anything. You can just order this omega-3 fish oils in capsule form. I think the best thing is krill oil. Whales eat that stuff, and I've never seen an unhealthy whale. So these are good alternatives to ibuprofen. Another one is just plain old-fashioned ice. Now, the good thing is you don't have to call the Arctic Ice Company and have some guy bring it up in a tong. You just can get a gel pack, or you can get a bag of peas, frozen peas, or you can get just some ice in a bag and slap it on your back and kill that inflammation. Now, the method that we use up here to correct the problem so the inflammation goes away is decompressive adjusting. I use a computerized adjusting instrument. So we'll get on the the segment that's out of position, that's pinching the nerves and causing all that inflammation, and we'll separate it, get the bones moving again, get the pressure off the nerves so a lot of the inflammation goes away. Now, I like this computerized adjusting for a couple of reasons. One is it's more precise. It's actually stronger than my hands, yet it's painless. There's no pain involved, and it's safe. This instrument's certified by both Underwriters Lab and the FDA. I'm Dr. Graham, the back pain professional.